Thank you very much for talking with us. Can you take me back to that first meeting with Colonel Flaherty when you learned about this problem of the concussions?
Sure. No, that was a really interesting time. It was back in 2007, and very few civilian scientists and doctors were involved in military research at all. There was a meeting that was down in Florida that was really open to the public, but it wasn't really well known by the general public. It was really only the military scientists and investigators who would go down to it. And I went down because a friend of mine told me that I should be there if I wanted to understand more about the problem of concussions in the military. And I met a lot of people, but Steve Flaherty, Colonel Flaherty, was the person who seemed like he really had a clear grasp of the problem, because he was the chief of trauma at Landstuhl Regional Hospital in Germany, and he'd seen thousands of U.S. military personnel who were being evacuated from the wars in Iraq and Afghanistan, and he had enough numbers to have a real intuition, a real understanding of the problem. And he was also very serious about trying to do something different. He'd set up the first universal concussion screening program ever. So every single person, regardless of why they were there, was screened for concussion. So that was really quite visionary at the time. So when I met him, he initially was sort of gruff and not really welcoming or open-minded with regard to a civilian scientist. So it took a little while before he and I got to know each other and before he was willing to sort of accept the possibility that we civilians might have something to offer. But eventually he did, and we came around. We actually turned out to be a really great synergistic team.
So you show us in pictures what it looks like to be concussed, and you explain the technicals very well, but in this super basic plain English, what has happened to a brain that's had a concussion? Is it breaking down?
Yeah, that's a great question. A brain that's had a concussion has had some of the wires torn. So the wires, they're called axons. They carry information from one part of the brain to another, electrical signals. And in people that have had concussions, some of those axons are torn. Most of them are not. Most of them are still okay, but some of them are. And that's the main thing that happens. So like, for example, if people have a concussion and then die from something else, and then they come to autopsy and we look at their brains under a microscope, that's mostly what we see is torn axons. Occasionally we see a little bit of bleeding, but not much. Occasionally we'll see some swelling in the brain, but not much. It's mostly those torn axons in the short term. And then at later times, the brain has inflammation afterwards. It's got some inflammatory cells. Any kind of injury causes inflammation, right? And you're always going to have swelling and redness. And so later, there's some inflammation that happens in the brain. But the first thing that happens is those torn axons.
And then because people aren't quite right for a couple of days, but they do in some ways get better, are some of those axons repairing then?
That's the interesting thing. So it doesn't look like the axons actually repair. And so there's a disconnection between how the patient does and how the axons do. But what it looks like is that if you're trying to send information from A to B, the most direct route may not be working quite well. But you're able to find over time a pretty good way to send information from A to C to B, even if the primary route isn't working properly. And so that's why we think that people are getting better over time. We don't really know, but that's what we think is probably going on about why people get better over time. Most people do. 80 to 90% of people make a full recovery from a concussion. 10 to 20% of people don't. And one of the things we're working very hard on is to try to figure out why it is those 10 to 20% of people don't get all the way better and what we can do about it, what we can do to help them.
Are there any theories that are far enough along you can say they're a theory?
Sure, well, we have a lot of theories. So some of the big theories are that different people's genetics predispose them to recovery or not such good recovery. So like a good example is that people that have a very strong family history of migraine headaches, or they themselves have a very strong history of migraine headaches, often don't recover nearly as well from concussion because the concussion triggers really severe migraine headaches. Likewise, people that have had multiple previous concussions may not recover nearly as well from a subsequent concussion the way they would have from their first concussion. The accumulated injuries, perhaps, or the loss of reserve. They just run out of alternative pathways to get to B from A. And then finally, there are factors that we just don't understand. There's just so much more work. We're at the really early days and that's what makes this exciting, is because there's so much that we don't understand.
So when you get farther into your research, what is the eventual goal of what you're trying to figure out with the whole body of research? Is it a cure, or are they even the least bit curable?
Absolutely. So my vision is that if after somebody has a concussion, we'll be able to do a scan or a test pretty much right away. And we'll be able to tell that person and her parents or his son or spouse or, the people that matter to that person, this person is going to do fine. Just need to rest, do a little bit more activity each day, tomorrow a little more, tomorrow a little more, the next day a little more, the next day a little bit more, and you're going to be okay. The scan looks fine. There's not going to be any long-term problems. And some of the people we're going to be able to say, well, this concussion is a little more serious. And here's what we need to do. We're going to give you a medicine. We're going to give you some treatment, some medications, and we're going to give you some specialized therapy that's going to help you recover as quickly as possible. Right now, we can't do that. So right after a concussion, we have no way of telling who's going to be in that 80 to 90% group and who's going to be in that 10 to 20% group. We'd like to get therapies started right away and get medical treatments started right away, because we think that the earlier you intervene on these things, the better people will do. That's true in just about every other aspect of medicine. So that's the first step, is to be able to identify the branch point. And then we actually have quite a few really interesting therapies in terms of cognitive therapies and physical therapies and sleep treatments and medications. We just don't know exactly who to give them to until later on in the game, when they've declared themselves that they're not going to get all the way better. So I spend most of my time in clinic. I run the concussion clinic at Washington University, seeing the 10 to 20% of people who have not gotten all the way better. And sometimes we're seeing them even years afterwards, and we're trying to do rehabilitation and give them medications and give them treatments, which is better than nothing, and they certainly work, but we think they would work a lot better if we had started earlier.
How does somebody come to your clinic?
They get referred from a lot of different ways. So usually other doctors refer them. So most typically they've seen a primary care doctor or a pediatrician, and then they may have already seen another neurologist, and then they come for a sort of a third level referral to the concussion clinic, the traumatic brain injury clinic. And it's not just me. We have 5 doctors who do the traumatic brain injury clinic, the concussion clinic.
And is there either a common misconception or something that you think people really need to know about getting concussions, avoiding concussions, treating them, anything in that?
Sure. I'm glad you asked. For a long time, we sort of neglected concussions altogether. It was something you just shook right off and got back to doing. The problem now has been the opposite. We are now overreacting to every blow to the head, every fall, every hit in the head, a soccer heading event. We're now overreacting. Most of them do not cause concussions. Most of those minor blows to the head, minor things like soccer headings, do not cause any damage at all. And so the misconception, I think, is that one should not swing too far to one side of ignoring concussions altogether, but one should also not swing so far to the other side of over-protecting and over-coddling and over-resting after even really trivial injuries. So finding that happy medium, what I call baby bear's porridge, not too hot and not too cold, but just right.
Nice. So then what is your take on some of the more contact-heavy sports that there's currently the debate around, like football or headings in soccer?
Yeah, I get asked that all the time. Most people can participate in those sports just fine, without any long-term consequences at all. So most people go through football and soccer and contact sports without any concussions or any long-term problems for concussions at all. But after one concussion, one should be pretty careful about returning to play in a contact sport. So, for example, if you've never had a concussion, you can perfectly fine to go through, but if you do have a concussion, then clearly you're not the sort of person that's never going to have a concussion, obviously. And then, as I said, most people don't recover from their second or third concussion nearly as well as they may recover from their first concussion. So I have a son who's 10 years old, and he loves mixed martial arts. And I told him, great, I'm really happy that you're so into mixed martial arts. If you get a concussion, we'll have to think about whether it's time for you to stop. he's never gotten one, and his coaches and trainers are really careful, and they do a really good job with protective equipment. And I think most coaches and trainers do a really good job with protective equipment and identifying concussions. But that's the key, is that once somebody's had 2 or 3 concussions, it may be time to stop. And I see lots of professional athletes, and I have this conversation very frequently with athletes and their parents.
Great. Thank you very much.